Happy Wednesday, everyone. It is October 8th. I am so excited. I say that everyone is my favorite one, but putting this one together, I know this is a crowd favorite to talk about. And so I know I'm starting a little bit late. Again, I apologize. I jumped out of the baseball game. I went into overtime a little bit. So I am here and ready to go. So this may run just a few minutes over. I want to respect your time. So I will make sure we have a question and answer at the very end. But I did add a little bit more to this presentation since it's a very hot topic, to create a little bit more of a shift in the health paradigm that we're going to talk about. So welcome everyone. The chat is open for you to ask questions at any point in time. I will make sure we save time at the end for open, casual conversation, questions, whatever it is that is on your heart that you may want to share. At any point in time, feel free to put your questions in the chat, though. I will answer them as I go, and a lot of my wonderful co-hosts on here will help answer them as well. So first and foremost, I'm Dr. Kayla. I am local to the upstate of South Carolina. The most important thing I want to share with you here today is keep an open mind. I want to welcome you to absorb some new knowledge and wisdom that your body already knows, and we're going to talk about that here in just a moment. Let me silent this phone. All right, so first and foremost, this presentation is for information and educational purposes only. It is not intended to treat, diagnose, cure. We're not talking about any type of medical condition or giving any specific advice as such. So open your ears, open your minds, and allow this wisdom to create some thoughts or questions for you that you can go back to your primary care physicians or that sovereign health team that you have that you entrust with your health and well-being. I am a chiropractor. I'm not your chiropractor, and I'm not a medical doctor. So everything here, we're just going to learn and expand. So let's dive in. If you've been tuning into these, you know how they roll, but they're a little bit different every time. We're going to introduce myself, go over the biological laws, talk about that really beautiful health paradigm shift that's going to happen here today, and then talk about how our own light is a pivotal, vital force energy. We'll go over the step-by-step tidbits and suggestions that you can look into for yourself and make the best choices for yourself. And then any personalized, super casual, you can unmute yourself and have any types of questions and answers that you are looking for. So I am Dr. Kayla Abeid. Like I said, I'm a chiropractor, not a medical doctor. I work in the world of Germanic healing knowledge or German New Medicine. We'll talk about that today in reference to the 5 biological laws of nature. I also have a master's in nutrition and human performance and some really cool background that always comes back up in exercise physiology. I feel like I've lived 1,000 lives and they all somehow have woven their way together. So my purpose here tonight, again, for educational purposes, is to guide you to self-healing through the biological adaptation lens, looking at light, looking at frequency and energetic codes and how our body is already functioning for us. So let's dive into the 5 biological laws of nature. I teach literally an entire 6 hours of course of introductory on this. So I'm going to give you a very brief overview, enough for you to digest and soak in something today and maybe be curious to learn more and ask questions at the end. So the 5 biological laws of nature were discovered by Dr. Hammer, who was a German medical doctor, an internal medicine doctor, who was serving thousands and thousands of patients who had cancer. And he started developing some type of insight as to categorizing these individuals based off of what type of cancer they experienced, and then also what happened to them prior to them having that onset or that diagnosis. And so he himself, unfortunately, experienced a pretty big shift and conflict in his life when his son was accidentally killed at a very young age. And so he actually experienced a onset of prostate cancer after that loss of his son, and that is what struck him, the big light bulb in his head of this has to mean something. So we started looking at thousands and thousands of cases and then discovered the 5 biological laws of nature. And they are laws. They are not theories. They are not hypotheses. They are laws. And so therefore, they apply to any human, animal, plant, living being, and we talk about them exclusive to the psyche, brain, organ system. When we talk about science, the psyche, brain, organ system are 3 separate things, but when we talk about them in our body physiologically, they are one. They all work together hand in hand. You cannot separate them unless you are just learning about them. And so the good news here is you're going to learn a lot today. You're going to learn a lot. You're going to probably have your jaw on the floor and be like, I never thought of that, but that kind of does make makes sense. And so you don't have to worry about writing things down or trying to learn it all right now because you're already attuned to the five biological laws. Physiologically, your body's always been responding this way. It's just like learning a new language, right? You may want to learn some new language, experience what's going on, but it doesn't really matter because your body's already doing it. It's just like the law of gravity, right? We don't have to think about standing on our 2 feet and defying gravity every time we get up in the morning. The same thing applies to the five biological laws of nature. So, our biggest thing here that I want you to leave with today, and my intention, is an awareness and a shift in perspective that will activate these conscious connections of what's already going on subconsciously behind the scenes. So here in very, very short, easily digestible ways, these are the five biological laws of nature. The first one is every symptom has a meaning. And so this makes sense because every time we know we have a symptom, we want to think or understand what's going on with it. And instead of trying to figure out how to turn that symptom off, we're going to look at, again, perspective shift, what that symptom means and is telling us communicatively. And we want to be able to look at that with a different lens. Next is conflicts trigger biological responses or programs. And so it's just not by random that you get sick. It's not by contagion that you get sick. It's because you experience a conflict in your body that your body now has to have a response. So it's kind of like the cause and effect rule, except for you experience a conflict that is completely shocking, not able to be predetermined, and leaves you speechless essentially, and you couldn't ever see it coming. That type of conflict, whether it's someone saying something negative about you, you getting something in the mail, getting a phone call, almost getting to a car accident, getting devastating news, right? Like example, Dr. Hammer losing his son unexpectedly. That conflict triggers a biological response. Your body has to respond. Your nervous system has to respond. That psyche, brain, organ cascade is where this comes in. And when it responds, it has to find a solution. It has to figure out what happened, how we're going to deal with it, and how we're going to resolve ourselves back into that mode of rest and digest and not just be stuck in that survival experience. And so healing will then follow after we find that resolution. So if we're in the fight or flight mode looking for a resolution and we find a resolution, we take ourselves out of danger, we understand, we process, we find some type of resolution to the conflict we experienced, our body then goes into a healing phase. And this is number 4 next. This is the one that most of the time puts people's jaws on the floor. Microbes assist in this repair. We need them. If we don't have microbes, we don't have bacteria, we don't have fungi, we don't have those essential repair mediators, then we don't actually have full resolution of healing. We could heal tissue without having microbes, but it's incomplete. We're kind of cheating that system. It's like cutting something out of your body. That's healing, but it's not a full circle of healing in the body. And last but not least, each program has a predictable pattern. Just like I said in the beginning, there's only so many different ways that our body can, misfunction or misfire or have miscommunication because we all have the same amount of organs. We all have the same amount of bones, muscles, tissues, and cells. And so it's a very organized, predetermined physiological process. And so if we experience a conflict and our psyche turns on a specific program, it's very predictable on how that pattern will run. The only thing that isn't predictable is each and our individual psyches determining what program our body turns on, because that's how we become individuals and have each of our own personalities. So let's talk about this in terms of pain, because today we're talking about joint pain, we're talking about chronic pain, we're talking about joint dysfunction, any type of alarm system, if you will, where you feel like you're in this fire moment that we have to either take the fire alarm off the wall and throw it out the door, which is what most of us do in the terms of painful resolution. It's a temporary resolution. It's typically wanting to put out the fire of the signaling, and we don't actually ever tend to the fire or the cause of the fire, if you will. And so we're going to talk about this just like we talked about in other sessions, that pain is not actually a root cause, just like we talked about sleep not being a root cause and low energy not being a root cause. And we talked about all of those other things being essential to our healing. And pain is actually surprisingly no different. we have to have inflammation during a healing phase. We talked about that, I think, extensively in all the other sessions, right? Inflammation in terms of repair is essential. When something's repairing and going into that repair process, we have to have inflammation. We have to have heat. We have to have exudate or some type of liquid to bring in and seal off and repair that area. And so pain is a natural part of that repair process. However, we're going to talk about situations where it may prolong itself or kind of flip-flop back and forth that it is a continuation of something that is trying to resolve. So when we look at pain, it signals inflammation for, there's a brain that signals inflammation for repair. And when that repair process happens, we're talking about cellular regrowth or cell loss. So depending on which area of the body there's a conflict in, we either have cell growth, we either have cell loss, or we have function loss. And we're not going to go into all of that today. If you really want to dive in, that's where I educate more in all of that introductory education. But for the ease of this process is conflict happens, resolution is found, then comes pain, inflammation, heat, and then we continue on in that full repair process. And our goal is to finish full cycle, that entire roller coaster, if you will. However, what happens is most of the time when we have chronic pain, we're not allowing that full loop to process. So we have heightened nerve awareness to protect our tissues. The pain is saying, please slow down. We have healing in progress. So it's like the cones on the freeway that drive you nuts when you're driving and you're trying to swerve around them. That is like the pain. The pain is saying, please pay attention. Please look at me. I'm trying to tell you something. You need to slow down. We need to take a deep breath at this moment because pain is not something that means it's bad. It means it's healing. Now we could look at GNM and looking how pain often shows up after the conflict active phase because there has to somehow, some way be more tissue, more cells, more energy, more tools, if you will, brought into that site to repair. And that can be a painful process because you're trying to put more information into an area that typically doesn't have that much stuff built up into it. So when you break it down this way, you could look at the rebuilding process, the restoring circulation process, and reminding you to rest process as a signal. And that pain is a natural part of that process. So let's shift now and look at what happens when we have chronic pain. Because, right, there are different types of pain. Like we could have a situation that doesn't even apply in GNM, and that's spontaneous injury. If you have a spontaneous injury, you fall off a ladder and you break your leg, that pain is a 100% alarm that you should probably do something in this moment. But if we haven't had any type of chronic injury or spontaneous injury and we have long-term chronic pain, we want to look at what is that pain telling us? What part of the loop are we in? Are we in a healing crisis? Are we in a conflict active situation? Because there are a few programs that there is pain in the conflict active phase. Not many, majority of the time pain does exist in the healing phase, but we just want to start communicating to our body, what does this look like? So if you have chronic pain, that's typically a cyclical reactivation of conflicts. And I'm going to share really specific examples today to make sure we can differentiate between these types of pain in just a few moments. Unresolved stress keeps the body in repair loops. So, and stress can be anything at this point, right? But if we're not able to find resolution and fully resolve something, so let's take the typical 9 to 5 process. Let's say something happens with your boss at work. And it happens to be that the boss says something that makes you feel less than. You start having low self-esteem, or you have a feeling that you cannot perform, or you have a feeling that you can't keep up with the workload, and it's an added stress. And now you start noticing that you have wrist pain because your job is you sit at a desk and type all day. This is not just a matter of you have poor posture and your body's not in a great mechanical position. It's that you have a self-devaluation conflict, and that was elicited by your boss saying something to you that you then shock, not able to understand. And so you notice that on the weekends or when you're home from work, you have no chronic pain. But when you have this process that you are off for a vacation, it just goes away magically. But when you notice that you go into work during the day, you start to have some pain, and then you go home and the pain gets worse. And it gets better by morning, and then you go back to work and the pain goes away. And you have this process of like this roller coaster pain. But then you look and you see, when does your boss show up? Has your boss only in on Mondays and Fridays? Is your boss there 24/7? These are things that help, or not help us, but prolong us from finishing that long-term healing cycle and keep us in that repair loop and seeing that chronic on-off loop of pain. Then we add an inflammation. And again, this is going to typically go along with pain because inflammation and pain coincide with each other. And so you're in active healing. And so some people think, just like the example I shared, you get off work, you have more pain, and then you go home and you think it's probably because you're at home. Well, that's not typically not the case. You actually are away from your boss. The inflammation is now starting to ramp up again, and you're in active healing, not actually in failure. So we're going to look at easy ways for you to be able to digest this process and understand a little bit more what happens when you have pain and when you don't. So chronic pain happens when the same conflict is triggered repeatedly. Inflammation has to be there. This is so important. Most people like to suppress it. They like to take, and they like to take all these things to take the pain and the inflammation away. But what they're actually doing is putting themselves back into a conflict active loop. And of course, the goal is to support restoration and return to equilibrium always. So let's look at these conflicts. There's three categories we're going to talk about today. Self-devaluation or self-esteem conflict. I'm not strong enough. I can't stand up for myself. It's your typical, I'm just going to, victimize myself because I think I'm awful and I can't do it. Then you have mobility conflicts. This is I can't move forward or I can't escape. So this is actually like I can't move out of this situation. I'm feeling stuck. And then there's performance conflicts, looking at feeling incapable or restricted. And again, this could be any type of performance. And so the key here is if someone has a specific set of symptoms, it doesn't yet, until they're in healing, determine the exact conflict until we know what that predetermined process of healing looks like. So if someone says, oh yeah, I feel like I'm not strong enough, that doesn't always mean they have a self-devaluation because it's our psyche that determines what our programs are going to be, and we don't get notification of that. You typically don't know what conflict you've resolved until you're in an active healing phase and you notice the symptoms and you could categorize them back to a specific conflict. So different joints carry different themes. We're going to go through that. And when we have these emotional perceptions or these perspective shifts consciously that happen, we know pain will appear. And so when we have that knowing, and this is where the education key is important, then we know what we're going to expect. So if we know we have a conflict happen and then pain comes on, we're not in fear of the pain. We're actually empowered to understand what it means and to help mediate and make choices and take responsibility for whatever it is to help push that further into completed resolution. So overall, we want to understand that the message allows our energy to flow freely again, and not that pain is just this, full stop, we have to do something, it must mean everything is broken type of mentality. So let's go into self-devaluation conflicts. This one's the most common. I would say majority of people I work with have some type of self-devaluation conflict. I've had a self-devaluation conflict. We live in a very modern day world where what do we always do? We're not good enough. We're not fast enough. We don't make enough money. We compare ourselves to other people, right? And then those people say something to us off the cuff, not meaningfully, and we take it and we beat ourselves up over it. We have a lot of shocks that happen. This one's very common I see in children a lot of the times because we're all saying things to your children are saying things to other children that they just aren't ready for, because being a human out in the world is like a really hard thing sometimes, especially when you don't know and you're a new child and you're just interacting with people for the first time and they have different life experience than you. And heck, that even happens with adults, right? We're all diverse and we all have different pain points, tolerances, understandings, cultures. And so this is very prevalent. And this is typically why you see the long-term rise of different arthritides. Yeah, M says humaning for sure. So you have different osteoarthritis, rheumatoid arthritis. You have these are the things we're talking about in self-devaluation. So feeling less than, feeling weak, feeling incapable in some part of yourself. And this commonly happens in relationships. Why do we think we see a lot of women in this situation? We see a lot of women, feeling less than in their relationships after having a fight with a partner. We can see and start to not pathologize them, but actually humanize them and to see why people experience the things that they do. And so any type of self-devaluation is always going to affect the musculoskeletal system, so joints, tendons, muscles, bones. So some specific common things I typically see. A mother feeling like she's failing to protect or provide for her child. A person who can't keep up with physical work, saying my body just isn't what it used to be. Why do we typically see these things come on as we age, right? The myth of aging here, we know that we typically see in society these things are told to us. So we're predetermined to believe these things when our knee goes out. I'm in my 30s and I see those memes all the time. It's like, well, it must be 30 because my knees stopped working. I'm like, no, my knees are great. Like I have great knees. I'm not buying into that because it's not our hereditary. It's not the genes that we were passed down. It's our experiences, our conflicts, and how we're responding to them and finding resolution to them. So feeling judged by others, again, we just live in this competitive world where we can't all just get along and cheer for each other, I guess. They think I can't handle it. They're internalizing that message. A man who once prided himself on strength and independence, but now needs help and feels completely useless. After an injury, this is very common. So think of, you fall, you slip, you have a work injury, you're an athlete and you're no longer an athlete and you feel less than. And we could look to the common areas that I typically see. Shoulders, this relates to burden, responsibility, caring too much. So women, men, I mean, I think there's classifications for both of us in there. Back or support or feeling unsupported. I'm a chiropractor for goodness sakes. It's been, 8 years of seeing people with, disc degeneration, bone degeneration, all kinds of, they follow or they don't fall over, they bend over and they pick something up and their back goes out and they have no idea what happened. That's self-devaluation. So anything joint, tendon, muscle, bone, when you think of somebody that they've gone through, it's always self-devaluation. Hips, knees, moving forward on purpose, wrists and hands, capability, grasping or creating. So any of those things that work in that perception. I will make sure this gets posted to YouTube, but I always like to share this for self-devaluation because when you read this, your conscious awareness can connect with your subconscious awareness. And I know it may sound crazy, but just knowing that this is going on in your body is enough to resolve problems or conflicts in our system that we want to resolve without having to look to something else to fix it, because that's how powerful our body is. So if you want to take a picture now, don't worry, it'll be on YouTube in a little bit, but this is a little bit more in depth of those self-esteem conflicts in great detail. Mobility conflicts, so feeling stuck, trapped, or unable to move freely, physically, emotionally, or situationally. So these also affect joints, ligaments, muscles related to motion. And so we could look at someone being unhappy in a job or a relationship, feeling like they can't leave. We have potentially an elder parent moving into a home and feeling confined or restricted in their own home. So a really great example of a lot of these conflicts is to look at them in the real world, right? We talked about previously how when you separate, maybe when an older couple loses a spouse and then they start developing memory issues or they have signs of early dementia or Alzheimer's, that's because our body goes into a biological response, a meaningful biological response to protect ourselves and start to forget that person because that loss was so intense, right? And so the same thing can happen depending on the elder person's psyche if they're separated from a home or they have to go to a facility to live in. They may feel like, oh, my children don't think that I can care for myself anymore, and I'm, confined and I can't get out of my bed, or I can't move anymore, and look where they put me, right? These are biological responses. So people aren't just thinking these things, our body's actually feeling them. So I always tell everybody to dumb it down in a sense. I know that's not politically correct, but to dumb this down to make sense to ourselves. You are a baby deer in nature. You are a wild animal because we are primitive beings. So if you separate, a loving couple who's been together for 50 years, biologically, they feel like they've lost safety. They feel like they've lost their territory. They may feel like they're incapable because now decisions are being made for them. And it doesn't, sometimes those decisions are necessary, right? To take the keys from someone from driving because they can't see, right? That's something that it's highly necessary to protect other people, but biologically, someone may experience mobility conflict because of that. A driver trapped in a long-term commute, hating every mile, can't change it, like thinking individuals who drive long distance for work, recovering from surgery and fearing movement. If I move, I might make it worse. I've experienced this one before. So there's a lot of different things, whether it's from children to adults and so on. Common ones I see are knees and feet, hips and pelvis and ankles. That's typically your ones wanting to walk, get away from something, feeling stuck, feeling trapped, or pinned behind. And then performance conflicts, feeling like you failed, fallen short, or can't meet expectations, your own or others. Again, it's your psyche that determines this. So it's not up to anybody on the outside. Your own well-being determines how it experiences each conflict in real time. These affect muscle fibers and tendons used for precision or skill. So this would be a functional loss type of experience. And this would be an athlete or a dancer injured, believing they'll never perform at the same level. A business owner feeling like they're dropping the ball or under delivering. A student who freezes on a test and later feels ashamed, I should have done better. A parent comparing themselves to others, I'm not doing enough for my children. After criticism from a boss or a partner, I just can't get it right. So these are common things that you'll hear people talk about. And I mean, everybody, I think, can appreciate psychology. This is no different than psychology. You could really learn a lot about people's conflicts based off of the things that they talk about and how they express themselves, because our body wants to find resolution and we want to be able to get to resolution. So our body will communicate body language, some of the cues we talk about. And so it really is like, I love it. It's like people watching. It's like a new form of people watching you can experience and just know what's going on with somebody by other conflicts that they've experienced. And also that gives you so much more, for me at least, it just gives you so much more humbleness and gratitude for what people go through and not being able to actually physically see what they've gone through, but just how they carry themselves and the words that they use and how they're able to talk about their lives. You could see and experience these conflicts in real time, and it just gives you, so much love, I think, for humanity, to love on people, knowing that like they may never said they've went through something, but they really have gone through something because you could see it by their diagnosis, by their experiences they've been through. I mean, if someone says they have, chronic pain, they and most of the time that's from bones, joints. I mean, even look at juvenile rheumatoid arthritis. Look at those children and what they've potentially gone through. Something happened to them in their life that their body turned on the program for self-devaluation at such an extensive intensity that now they're trying to figure out to resolve and to move through that resolution. And oftentimes we just miss the mark and think, oh, it's just because of their genes, they got it. And we need to shift that in society because we could really resolve a lot of these things for a lot of children, especially, and being able to understand what their body's saying. So moving into that, what does that mean for freedom from pain? Because I get it. I've been in extensive painful situations in my life. I've been fortunate and unfortunate enough to experience pain at high levels where I've not been able to take my pain medications in pregnancies, during injuries. I was 27 weeks pregnant and I broke 4 bones in my foot, was not able to take any pain meds, was not able to have surgery to repair it. So I understand that pain is uncomfortable. I've had kidney stones. I've solved lots of programs in various aspects that required pain. But I want you to know and understand that pain comes from a place of awareness. And so I have been grateful enough and humbled enough by pain to be able to experience this in real time and play with it and learn how to consciously and unconsciously shift my pain. And so I want to share a little bit about this. And this is a little bit that I don't typically share on the other sessions because pain is something that I think majority of people experience in their lives, whether they want to admit it or not. And it's something that we really can form an identity with and make it outside of ourselves instead of having an awareness to it and building a relationship and a trust with it. So if we look at pain, we want to first identify the message behind the pain. And these are the things that I talked about today, right? Start categorizing when your pain happens. And the first shift is when I'm in pain, it's 95% of the time a resolution of some sort. And now, if I'm experiencing that pain daily or weekly or monthly, and it's in accordance with a rhythm or a cycle or a place that I go or a person that I'm around, yeah, you're probably in a hanging healing where you're going in and out of healing because we haven't had enough awareness of what that key player is, what the conflict is underneath. And so you can support your body with pain, releasing situations. You can support yourself to be pain-free so you don't suffer. Please don't take away from this that I think everybody should suffer from pain. That is absolutely not true. There are great ways, and we're going to talk about some, to help naturally reduce the intensity of pain, potentially even get rid of that pain in a healthy way that it doesn't put you back in conflict activity and actually allows the resolution to fully happen. But we have to first trust. and find a trust and a relationship with pain that it might actually be for a better communication and a better resolution than making us feel like we're broken and less than. So when pain loses power, you completely understand its purpose. When you have this subconscious mind controlling our pain, we understand that we could turn it off. And so I don't have time to teach this today. I might do it in the future. But there's a technique written by Danny Carroll. He writes some amazing books and amazing pamphlets on various different conflicts. And I invite you to check him out. The truth about was it the truth about terminal cancer is a great book. I can't remember what exactly it is. I'll put it in the chat notes for the replay. Um, Oh yeah, Em said she read the truth about the breast cancer one. Yep, absolutely. So he has created something called the bioswitch technique. He himself has gone through several resolutions of multiple carcinomas, multiple bone, especially jaw, self-devaluation aspects as well, and found a way to educate those to turn off the pain and the subconscious programming that happens behind it. He uses something called a flashlight technique as the intro for that. So I want to share that with you here just to give you a little bit of a glimpse. It works really well. You just have to, again, like anything, you have to practice. It's not like just doing it once and it's going to work. You have to really align with it. It's that deep trust and relationship that we have with our body. So in our brain, right, we just imagine our brain is like let's just go with like a baseball field, right? Because I just came from baseball. And you have different, baseball stadium lights that come on when you gets dark, your game is about to go into the evening time, maybe you're in overtime like we are, and the stadium lights come on. And so imagine your brain as a baseball field, and you could turn on and off stadium lights at any point in time that you want. And so not to go into the in-depth of where this comes from, but when your body goes through a program, it forms a little focus dot in your brain somewhere. And so what we're trying to do in this aspect is turn off that conflict. Tell our bodies that we're safe. Tell our bodies that what we're going through is necessary, meaningful, and we're finding resolutions so that we could get out of this massive survival mode and get back into normal tone and normal rhythm and normal function. So if you're going through some type of pain, just imagine somewhere in your brain that there is a light on, like a flashlight, and you are turning it off. And every time you flip that flashlight switch, that light goes off in the brain. And we need to start coinciding it with every time we turn the switch off, we turn the sensation for pain off. And again, I'm going to say it. You may have to do this 100 times in the next hour to 2 hours, but get yourself on a feedback loop of every time you feel pain, I'm turning the switch off. Every time you feel pain, I'm turning the switch off. I teach my kids to do this, and they've been through some gnarly, my son's been through some gnarly things, putting his teeth through his lip, and we've been able to really pain gate that experience and keep him present so that he doesn't lose it. Because, kids, it's scary. It's scary for anybody to be in pain. So practice that. You could look it up. His name's right here. You could go to his website and take the BioSwitch class. It's really great. And then of course we want to just reconnect with your body's signals because that restores confidence, safety, and vitality. And that's the whole point of this. You've seen this slide now. This is the 5th time. This is respective to pain, but this always stays the same. When there's safety, then there's repair, and then there's resolution or release. So pain can't fully be resolved by constant numbing, ignoring the body, or fighting the inflammatory pathway. We need it. It has to happen. Healing happens when conflicts resolve, circulation and energy can be returned, and the body completes the repair. So let's talk about medications for a second, because in the GNM world, we want pure pain medications that do not impact our inflammatory state. So if there is a necessity for a pain med in the German New Medicine world, the biological laws of nature would suggest that you choose something that's not going to impact the inflammatory process. And so that can help resolve or not resolve, that can help mitigate enough pain so that you are not suffering and you could continue to push through that biological healing process. So true healing happens when the body's natural energy flow is restored and you're able to move through that cycle. So let's shift gears to what I really want to share that has been just transformational in so many ways. And I know we talk about this a lot, but I want to shift it to a perspective not for vital life force energy because pain is something all of us want to be out of when we're in it, right? I don't know anybody who actually enjoys pain. We might endure it, we might understand and trust that it's for our healing, but there's always something, or a wish, if you will, that we have that we wouldn't have to experience it, at least to a super intense degree, as we are moving through something. So this is shifting from vital life force energy because we know that's essential, but what can we do in the active moments while we're also gaining vital life force energy and resolving these things? So I don't want to, of course, talk about treating anything or covering it up. We want to talk about how we're going to activate our own energy, shift that conscious mind, and have a tool to help reduce that pain, reduce that negative energy in the body, allow the body to be more at ease so it can fully repair without all that extra stress. So your body emits its own light. You have infrared light that you emit low level. Any living being emits it, and we're able to see that on night vision goggles, thermography. And this shows us that our body actually has the ability to become a regenerator, become a strong, vital force to allow ourselves to heal the way we were created to. And so I want to share with you today this little patch, and it's right here on my wrist. This little patch, we're going to talk about external, but we're also going to talk about another patch. So I'm going to start there. I don't have the pain patches on right now because I'm very grateful I'm not in pain at this moment. So the X39 patch is what I'm wearing right here. But when we talk about the Ice Wave patch, the Ice Wave patch is simply a natural, stimulant-free, drug-free patch that we could put on that has no ingredients in it. It works like magnets, if you will. There's a positive and a negative. So you wear two patches, a tan one and a white one. And we help break up that pain channel. That pain channel helps allow our body to come into more ease and more rest and not be so fight or flight and allow ourselves to experience that full resolution. Now, I say that because Ice Wave, because we're talking about pain, is going to help you get out of pain, but it is not going to facilitate or help with the healing process with vital life force energy. So we're going to talk kind of a parallel process today when talking about patches because we don't just need to mitigate the pain, we also need to activate that vital energy force because that's what's actually going to help push us forward in that resolution and find that resolution long term so we could close that loop. So that is the X39 patch. The X39 patch is a patch that reflects your own light back into your body. Again, still no ingredients, still no side effects, still no drugs or chemicals. It's simply taking the own light that your body emits and reflecting it back. It has crystal rocks if you want to. You have little tiny particles of crystals that are mirrors that reflect back the light into your body and allow your body to then, depending on what type of patch it is, like we have the Ice Wave, like that works on the magnets for pain. X39 helps your body create its own inherent peptide, which is GHK copper peptide. GHK copper peptide is huge in the body. It works from all different types of things, from hair, skin, and nails to brain and nerves to lungs, to skin. It works with pain as well, but it actually works GHA copper peptide to activate stem cell regeneration. And this specifically can help repair things like bone, like muscles, like joints, like all the things we talked about that typically most people don't find long-term healing in. They lead towards more of that continual degeneration process and get replacements, or they end up getting long-term chronic pain meds because they're not able to facilitate that resolution or that healing process. So when we talk about X39, X39 is the patch that everybody should be patching with. But if you are in pain, you don't have to suffer. So the perfect way is to help your body balance out vital energy and being pain-free at the moment as you're moving through that cascade. And the goal is, of course, to get rid of the Ice Wave and continue with long-term healing and resolution only with that X39 so that your body can heal. So again, I'm just going to go over because I know many people typically hear what I have to say, but it doesn't land yet because this is mind-blowing. It was mind-blowing for me too, and I thought it was too good to be true. It took me 6 months to actually believe it, and here I am over 2 years later, still wearing these patches. There's no ingredients that enter the body. It's completely non-transdermal, meaning nothing goes into your bloodstream. There's no vitamins, nothing in it. It's simply your own body's heat and light that's being reflected back in like a generator and creating your own vital energy and your own means of biological ingredients to facilitate the natural healing process. Therefore, there's no side effects, no contraindications to medications because you're not putting anything into your body. It's just the light that your body's already emitting getting shined back right back inside. Again, what's inside the patch is organic crystal molecules. Essentially, I like to call them rocks. I like to, make it very easy for people to understand, which is a proprietary blend of amino acids, sugars, stabilized oxygen, stabilized water that helps your body reflect and react in those situations. And then the biochemical pathways for healing and vitality based off of utilizing that light can determine what your body's going to do with that. So there's over 130 patents. Well, there's over 200 patents at this point, but 130 exclusive to all of the patch technology. We've been around for over 21 years and we are just getting started. So I like to share testimonials, but honestly, I couldn't pick just one because pain is one of the most profound reasons why I find people for patching and why I shift people's belief systems, their conscious awareness to the understanding that pain actually can be turned off and go away, not just with an outside tool, but with our belief system and with what's already inherently inside of us, that being our light first and foremost. So if you go to Linktree/lifetime or LifeWave testimonies, you're going to get pages and pages. Go to the pain section and you will see some of the most amazing and beautiful pain stories of people finding this conscious shift and understanding that their body can actually be a living, breathing, well-being organism and not be broken and feeling less than because they're in chronic pain and there's no fix and feeling like they have to resort to something outside of them. So I want you to take the time, again, I'll post this on the replay, but take a picture of this, spend a couple moments after our call tonight reading through this and moving through it because it is the videos of the testimonials they're bone chilling. And I've witnessed these in myself. I know Dr. Tiffany's on here. One beautiful cases in her office, she had a woman come in who had 15 years of chronic neck pain, unresolved, never, has literally tried everything, nothing touched it. Putting a set of Ice Wave on, in 3 minutes, she was down in more than half the pain that she'd ever been in her entire last 15 years. Me and Tiffany were just at an event in Pennsylvania patching people, and a woman behind us said, "Oh, I don't believe that that works because I've been in chronic pain. I've tried everything. I'm a nurse. And I don't even, I'm about to go get Botox injections because nothing has actually worked for me. It's been years and years and years." And so it took a little bit of time to figure out where her pain needed to be broken up with the Ice Wave, but we found it after about 10 minutes of working with her, and she had, again, the first time in years, she actually had a reduction in pain, and it continued to reduce, and then we, got her the X39 long term and explained that to her. So we can find easeful ways to shift our body out of that state. And so I want to share with you going over these easy tools to give you the step-by-step easy process. We talked about X39. This is the patch that activates GHK copper peptide, which we know GHK copper peptide activates stem cells. And so this is a patch that everybody should be wearing daily. It can help with inflammation. It can help with pain. It helps with cellular regeneration because of GHK copper peptide. Now let's talk about something we didn't talk about, because if I'm talking about pain-free and tissue repair, I said inflammation is necessary. However, if we're in chronic pain or we've had this in and out healing cycle and we're stuck in this healing loop of not finishing it, we have lots of inflammation in our body that actually isn't necessary for healing because it's like having too much of a good thing does turn bad. So if we've constantly been in pain and self-devaluating ourselves for 10 years and our wrists are swollen, our hands are swollen, we have all this inflammation, our lymph system's now not able to get rid of, right? It's like this cascade of conflicts that happen, right? And so we want to shift our body into a parasympathetic state. So Eon is a great patch to wear daily that can help with that anti-stress, like that ruminating on stress process so that your body can actually hear and listen to what's going on inside and be able to actually shift into a state of healing. I said in the very beginning that constant stress Majority of us are not going to quit our job because we realize it's our boss that's the cause of our self-devaluation, because we have to make money. We don't live in a world that we have that luxury yet. It's coming. But we have to be able to make these decisions for our well-being at the same time. And so Eon is a great way to help calm the body to find an easier resolution. And I see that all the time. Next is carnosine. I like to throw this in there because carnosine is an essential amino acid, and majority of us are deficient in it, and it has a really great impact on skeletal muscles, bone, joint regeneration. It's necessary for our organs, our tissues. It's essential for the brain. And so if we are self-evaluating or we have a motor conflict or a performance conflict, those all impact our brain. Those all impact our sleep. Those all impact our vital organs. We know everything is connected in that way. So carnosine is an essential amino acid. This one's really great a lot of the time for people with long-term skeletal pain, because we're majority of the time deficient in this essential nutrient. So adding that in is only going to put even more icing on the cake. And then we have our ice wave. So if someone's in chronic pain, the fastest, most simple ways to get started with either this easy core kit to get you started, or just simply even X39 and Ice Wave. So I want to invite everybody here, no matter if you're new here, you've been here for a while, or you keep showing back up, if you know somebody in pain, reach out to them and ask them if they're open to having a discussion to something that actually isn't going to put anything inside of them, but utilize something that their body's already creating, hello, their own light, to shift in their body that they could be able to actually feel in a pain sense. Because majority of the time, 95% of the time, we're going to notice a shift in pain in a few days to weeks, right? Because pain is something that's communicating to us that we should be listening, we should be responding, and we shouldn't just be, oh, we're broken and trying to cover it up. And so if you choose to start patching and trying these patches out, we're here to support you. We have a free education portal. We have an entire Telegram group that you get access to, a whole health tracker. We get to help guide you and share your wins with you. If you're struggling and you need some more help, or you just want some reassurance that this pain is necessary in this process and we can, bring it down a little bit, or talking about these things, we have an entire group that does this, responding, asking questions every single day. There's hundreds of people in there, and we help guide you through that. If you've been in long-term chronic pain for quite some time, you may want to save some money. This is just the easiest way to double up on those ice wave patches so you can have that pain-free as you're moving through that healing process. This is again $535 for this big kit that you get. You also get 2 other support sleeves. So you can get 2 more ice wave, another X39. Try some of the other patches that we're not going over tonight, but you can catch the replays on YouTube. But if you need help, the only question that is a stupid question is the one that's not asked, everyone. So be open and ask for help and reach back out to the person that invited you here tonight. And they can even reach out to me. So as we finish up here, before we have questions, I want to give you my experience that I've had with these patches. And that is, we may not experience things immediately. That's not the point of life, right? Instant gratification is nice and it's a modern day touch. However, it's not going to typically get us a long-term resolution or a long-term solution. It's an instant gratification moment. We get it and then we move on. And so most of the time when we cover up our pain with any outside in source, we forget about our pain. And then it gets reminded to us when we stop doing said thing, right? And so if we could shift this perspective and put something into our life daily that we're able to have long-term solution, one step every single day is adding another dollar into the piggy bank. That piggy bank is going to be huge. So my invitation to you tonight is to patch with these patches for 1 year. You don't have to wear the pain patches for a year. You're going to wear those for a couple weeks, but wear the X39 at least for 1 year, because here's what happens. In the first few days, 24 hours actually, of even wearing X39, you're gonna have 4,000 genes begin to reset. Within 4 weeks of multiplying, that 24 hours times 7 times 4, you're gonna get a whole new army. And now you're noticing even more. It's not just about pain now, everyone. The pain is going away. What's actually happening internally is the things that we can't yet see or feel yet. And so we know that research shows within 6 weeks, the brain is now becoming more balanced. That's when we see things that change, like sleep, like energy, like memory, depression, anxiety, that mental ease that comes. Then we see 3 months, we stick around, we have collagen increasing. We moved to 6 month, which is my favorite. It's not just about being pain-free, everybody. It's about age reversing. Every day you wear the X39 patch, it actually age reverses your metabolic cardiovascular system by a day in the third. So it's not about patching for pain anymore, anyone. It's about patching for vitality and going back to that vital life force energy. And so that's why I really invite you stick with this for at least a year because I get up in the morning, I stick my patches on, I brush my teeth, and I go about my day, and I can do it. I have 3 children under 6, it's 7 animals, and like 2 businesses, and a million things going on in my life. I can patch every single day. So there's no excuses because you don't have to like go do anything else, right? And so if you're in pain, we don't have to play a victim to our pain anymore. We could take awareness into consideration and say, actually, I could try something. And that is the biggest conversation I have with anybody in pain because it's so easy. I've been there, guilty as charged, to just say, like, oh, well, I'm in pain. Nothing's going to make it better. And, like, yeah, we could have our moments like that. But imagine just sticking a sticker on and finding freedom and liberation, even if it's just 10%, right? That adds up. So I invite everybody for a year to make this change, and you will see changes, I trust, beyond that little pain or that big pain that was chirping in your ear that led you to this process, because it's not about fixing something and in immediate gratification. It's about long-term vitality and vital force energy. And so I always give lifestyle foundations because I'm not here to just give you information on just patches. I want this to be a robust experience for everybody. So between the Germanic healing knowledge, between the patches, of course, we can always add more fun things into our life, but we don't have to, and that's the key. We don't have to add it all at once. If you're going to pick one, you came here for a shift today, you try those patches and these things come later, or they don't. It's up to you. This is your journey, and I invite you to walk it how you feel aligned. So if you want some more lifestyle information for those that are looking for it, we want to work on, having better sleep and wake cycle rhythms. That's essential. If we're not getting our ability to go to sleep in a process because of pain, we're missing essential nutrients that are happening in that nighttime process. And pain does affect sleep, right? That's the number one thing. So this constant cascade, we've been talking about these things for, this is week number 5 now, but they all wrap together. Energy, pain, sleep, they all go together. So if you want to continue on that process with Lifestyle Foundations, mineral support can help support that nighttime detoxing process naturally. But cell salts are also great for pain and inflammation. You could have Fairphos for acute inflammation and heat, Magphos for cramps, spasms, and tension, Calc Fluor for connective tissue, Nat Sulf for joint stiffness and detox support. But overall, water, minerals, minerals are essential. Getting rid of your table salt, get rid of the girl in the yellow rain jacket. She's cute, but she's not doing anything for us. So make sure we are getting either Baja Gold salt, real mineral salt, Redmond's real salt. Switch that out, eat as much as you want. It's great. It's our body needs it. We need all those minerals, especially if we're in pain, especially if we have inflammation that needs to be facilitated and processed in that way. Making yourself move, right? Pain is simply stuck and trapped energy. So if you could shift your perspective, you could add some means of your body changing and moving in that momentum. If we sit still, motion does not, like lack of motion does not help us. So moving in ways to have our brain facilitate communication to our body to find a different perspective is resolution. And then adding those cell salts to provide gentle energetic support for pain, for tissue and nerve rebalancing. This is building the entire pie chart together. So I want to open up for questions. I didn't actually run over too long, so I'll make sure I stay on for at least 10 minutes of questions here for everybody. But go ahead and unmute yourself or drop it in the chat if you have a question. That way anybody can get the time that they came for today. Yeah, Sloan, go for it.
So I have 2 questions, Dr. Kayla. First of all, fabulous presentation. Although I ate beforehand, I was getting a little woozy. But one, well, I also want to say one, I didn't really know about the carnosine, and because I had all the inflammation and the hip replacement, and I've been having knee and stuff, I'm going to add that back into my thing. So thank you.
Yeah.
But I think I messaged you. So I was addressing an older group of people, and one of the women that we patched with Aeon and Ice Wave, she had had cataract surgery and the eye then hemorrhaged.
Hmm.
She's lost vision in the eye, and she had all this pain up in the head. But my question is, so when we look at that, when we talk about pain and conflict, right? I had said to her, because the doctor told her when she went back on Friday that she won't see out of that eye anymore. And so I said to her, well, would you just maybe think about doing X39 and Aeon to see what we could do or whatever? But when we talk about conflict and we talk about pain from that, so how is the pain actually coming from the conflict of what happened in the trauma of the eye?
So that's a little bit in depth, and we can message more about that, but just in a general sense, if she had a procedure, there's a natural process of healing that happens, right, when we open something up. So like when we have, just like we have a spontaneous injury, right? So if we have spontaneous injury and like our bone comes shooting out of our leg, like there's a pain process of like that's not conflict resolution, that's an actual alarm system. So there's a conflict, there's an eye conflict that it seems like she resolved, and it was so intense that it she wasn't able to adapt to it, because that does happen, like, right, think of like someone passing of a heart attack is a resolution, but if the conflict was so intense that when it happened that person wasn't able to adapt to it because their vitality, their well-being, their ability to overcome just wasn't there, they will waste away and pass from it because it's not able to be adapted by or adapted to. So in the eye situation, if someone's losing vision, typically losing vision is a part of a different conflict. But if they've had some type of big conflict resolution that's led to a surgery, there's kind of this, there's pain potentially from the conflict, but also there's pain because she had a procedure. And so now the tissue is responding to that procedure. So speaking to, yeah, you could utilize Ice Wave for pain. If she's just wanting to try something, again, we can't predetermine what's going to happen because we're not treating with the patches, we're not treating with GNM. The body's working via the biological laws no matter what we do. Like, there's no way that we can change it. We can only interfere with it and push it back into a state of conflict activity. But it sounds like she has a lot more potentially going on than that. So I would start with X39 and Eon, and if she wants Ice Wave for pain, use the Ice Wave for pain because she is in pain. It really doesn't matter what the underlying cause of that pain is right now. She's just suffering. I don't think anybody should suffer. There are cases, and I want to say this too, is like I should have mentioned it earlier when talking about pain. Nobody wins a prize if they don't, if they suffer through their pain. Trust me, I've suffered through a lot of my pain, and I like regrettably wish, knowing what I know now, I would have actually allowed myself to help myself because it was like this prideful moment of like, well, I can't put anything into my body. Yeah, like we all live and we learn. I really wish I would have taken medication for that kidney stone. Let me tell you that. That was nasty. That was worse than all of my three unmedicated births. Um, but with that, when you understand conflicts and you understand physiologically how the biological laws work, let's take the lady with the eye situation, for example. You could make better medical based decisions because they're not in fear. So it's not that I'm saying ignore the medical system. Like, all of my people in my cohort that we like study and train and understand GNM probably utilize the medical system more than most people would, but we don't utilize it in a reactive way because we understand that there are going to be meaningful biological conflict resolutions that we can adapt to. And if we know someone had a conflict like that, like an impending heart attack that's going to happen, if they start having symptoms because we know what happened, we need to go get them help from the medical world. So in the sense of an eye situation, the same thing would apply. So by no means when I'm talking about pain am I saying like don't take pain medications, they're so bad for you. No, like choose something that's not going to negatively impact the resolution process. So for me, I would choose a pain medication that does not mess or interfere with the inflammatory state. And I would take it if I'm truly in a suffrage moment. If I can manage and handle the pain, then I'm not going to. And everybody's pain tolerance is different. So you could use homeopathy for pain. You could use the patches for pain. Everybody's different. But when you look at it from a vital life force energy standpoint, that's where X39 comes in because you don't know what you're not going to be able to adapt to. Because if that was the case, we would know when our end date was going to be. And we all wouldn't be sitting here trying to figure out ways to stay healthy. We would be concerned with living our lives until our end date was going to be there, right? And so we have to look at this in a bigger picture than just cause and effect. There's a lot of nuances that come into it. So this is why it's everybody's choice for themselves. So sorry to go on a little soapbox moment. I should have mentioned that in the beginning, but um, everybody's tolerance is different. Everybody's choice is going to be different. But regardless of that choice, choosing X39 could be an easy across the board opportunity for everybody's vital life force energy.
Well, I'm just going to say she messaged me and said, because she had 4 days of Ice Wave and Aeon,
Uh,
and she said that she is very much more comfortable. She had like excruciating headaches.
okay.
So that did help. So I'm working on that. Then the last question is the woman I messaged you about who said she used the patches and had the skin rashes. Um, and she has a husband who cannot, for reasons, have hip surgery, and his hip is deteriorating. So I'm actually going to send this to them. But I had sent them the core pack like you had expressed doing or whatever. But I was interested in how to address the pain issue with them.
So there's different ways to patch for pain. For someone who has like that chronic, like it's bone on bone, there's not much we can do based off of life circumstances. Couple ways to try. Something new that has been brought into my awareness by someone on my team is patching origin and insertion of a muscle. So that may be a great way for someone like that who's in chronic hip pain. Putting, the white patch at the origin, the tan patch at insertion, trying them different ways. So that could be something that we could chat about one-on-one. But you may not get a resolution of pain for all the way down to a 2 in that situation. You got to be realistic. But if you can patch with X39 and Eon and Ice Wave, you may be able to get pain reduced into like a somewhat tolerable situation, and then long-term solution would just be continually mitigating that pain because it is better than taking a pain medication in that situation. You can mix and choose and do whatever they want to do, but in the long term, like my opinion would be trying the least invasive way first, because it doesn't have an ill effect on organs, organ systems, and toxicities that we know. A lot of those pain medicines, even though they're necessary in circumstances, do have those side effects.
They're not taking any pain medicine, from what I understand, Dr.
Okay. Oh, cool. So yeah, I would try if you just have to, again, you just with long-term pain, chronic pain, like lots of self-devaluation, conflict, degeneration, you got to just keep trying different ways. And sometimes it's not even like on the hip. I mean, I've said it like we've tried some of the craziest ways because pain is a perceptive. So if the pain itself is in the joint and it's easy to pinpoint, we could put the patches on. But like think if someone's been self-devaluating so bad for 40 years that their hip completely degenerated, it's probably not in the hip anymore, right? Like think about like energetically, right? It has to do with here, which is why, yes, Em is pointing to her forehead. This is why this entire session today is really not even about pain patches on the place that hurts. It's about the belief system. Like, do we believe we hold the power and perception to shift our pain off? Because if we do, I mean, I've taught GNM to lots of people who've gone into resolution within 30 minutes of like the session being done. Like they're throwing up, they're in the bathroom, their pain is turned off. And it's not because I did anything miraculous. It's because they now have a belief system that aligns with what their body's trying to tell them. And now their body's like, oh my God, like that does make sense. And that's weird that it turned off. What do I do now? Enter X39. Continue the resolution, enter Eon, right? So there's something that everybody can take from it. So yeah, I would play around with it and have fun.
Amazing. Thank you.
Yeah, you're welcome. Anyone else, my loves?
I'm laughing because I, for like a long time, was patching my stomach, and I've started just patching, like wearing my most of my patches at night here, and I feel like I'm having wild dreams, which I appreciate. They're a little intense at times, but I'm like, okay, I think this might. So when you said that, I was like, okay.
No, I just stick patches in random places at this point. That's my fun thing, like talking about just being comedic. It's like I've started just like this is carnosine.
I was like, yeah, what? Okay.
It's carnosine. Actually, okay, to be really truthful, I have to put patches random places because Magdalena picks them off. So it's a game of how long can I wear my patches before Magdalena picks them off. So I have to I can't put them on my back because when I put her in the carrier, she picks them off. And the amount of times I've found patches in her mouth, I'm like, ooh, that's not good. Homegirl likes to eat patches. So like, please don't eat those. I need them on my body. So I wear a lot on my stomach. I wear a lot on like the insides of my arms where like she can't grab them. And then I wear them here because she's always grabbing my hands and my rings and not here. So it's like she doesn't see it. Or the tops of my feet. That's a no-go spot anymore. I used to love that spot. She likes to take those off my feet.
I used to love that spot too, but that's where I have skin expressions
Um,
and they're like, back off.
yeah, probably. I mean, I find too sometimes like, well, I mean, you live in Texas, so it's like heat also too, like in the areas where it's thin skin and there's a lot of heat expression. Like that's more of like I mean, I wouldn't say that's more like G&M skin resolution. That's more actually like this is rubbing and annoying and my body's trying to detox and I don't want something stuck here type of process I find with a lot of people. So awesome. Well,
I
thank you
found
all for
also in like the hotter months that
oh yeah.
what I can wear at the night works better for me.
Yeah, I do. I switch them all around. Again, there's like, we're not treating anything. There's
Yeah.
no wrong way to do it. Just try what works for you. And stay consistent. That's the thing is stay consistent because you can't, we didn't build Rome in a day. Can't tear it down in a day either. We didn't tear ourselves down and self-devaluate in one day and now end up with the current situation we're in. It took sometimes a long time, myself included. And you may notice, and I will say this as I close, the resolution of self-devaluation is very different for everybody, depending on which program they're running, whether it has to do with, their self-devaluation, their mobility, or their performance. But you may just notice that your bones ache a little bit more tomorrow. You may notice that your body feels a little bit, you need more rest, you want to drink more water, you feel kind of yucky in the morning. Your body will typically with the self-evaluation component, I find this new perspective of like, aha, like, oh my gosh, like how did that happen? And it can result by you just feeling heavy and yucky. So we don't have to have sometimes like a magic resolution to resolve something because it's our body knows what to do. And majority of us, especially those of us on this call that are looking for a solution, have downgraded enough to not suffer. So if you feel off the next 12, 48, 72 hours, just trust that your body's doing something that it's supposed to do, congratulate it, move on, get your X39 on, get your Eon on, your carnosine on, maybe on your arm right here like I do, and just keep on moving forward. So thank you all so much. I'll have the replay up by tomorrow. It was so great. We'll see you in 2 weeks back. I think it has to do with the gut. Yeah, I think it does. And I think Em may be sharing something with us that week too. I'm so excited. So anyway, we'll catch you in 2 weeks. Bye, loves.